Hi, everybody. Dr. Stephen. Yeah, I was talking about omega D3 earlier videos. Now, I want to say about very important trace minerals. I told earlier micronutrient, minerals, and trace minerals. In macro, carbohydrate, protein, and fat, which we'll discuss later. In micronutrient, all this vitamin D3, fat soluble, water soluble. Water soluble, there are 12. Fat soluble, there are 6. And then mineral, sodium, potassium, magnesium, phosphate, chloride, all this elemental salt is necessary every day in macro amount. That's why it is called macro mineral. Micro mineral or trace mineral has again 2-3 types. Whatever is there in the periodic table, all are important. In the trace mineral itself, higher quantity required. They're all called iodine, zinc, copper, manganese, magnesium, and so many other things. Very important one is iodine. Iodine is wonder mineral which is required for thyroid health, breast health, brain health, vascular health. Without iodine, we cannot survive. A lot of people drinking tea removes the iodine from your blood. Lot of people who take certain things which pushes the iodine. Example, cauliflower, cruciferous vegetable. High amount you take, you need to supplement this. Crucifer vegetable is very good, superfood. But all of you eating, not taking iodine with that. Even 2-3 drops once a day is enough. Put it in water, warm water, mix it, have a punch. That will prevent even throat pain. Can you believe throat pain? Cough, cold will not come much if you correctly take iodine. But it is there in our food. Examples, spirulina, seaweeds, all this has iodine. In Japan, that's why people don't get thyroid. None of them got thyroid. We in India, be careful, all of you take this wonder trace mineral called iodine. Iodine is also available in the lab, which is called sodium iodide. It is also in your salt. What you're doing, Tata salt, is sodium iodide, which is not good. It's not going to help you much. It's better to go for Lugol's iodine, which is potassium iodide. Expensive, it's worth it. This will cost you 200, 300 rupees. That's all. You can keep it for 2-3 months. There are big bottle for 1,000 rupees also available online. We are trying to come out with iodine in a very economical potassium iodide, Lugol's iodine. Iodine also available with the other minerals like Baha gold salt. People put and make a prefer iodine. In US, I think the iodine which causes $500 for 10 ml, but it is prepared for their finance. India, this is enough. This is called potassium iodide. This iodine also used in multiple IV testing, iodine uptake. You might have heard scans after giving iodine for thyroid. It's called iodide scan to find out about the tumor response, all that. So nowadays we give iodine in the thyroid itself. We put so that uptake is more. The patient has a thyroid mass. We do laser and remove the thyroid content and push in little iodine. It will take. It will absorb. It will help the thyroid function. If that happens, most of the thyroid inflammatory disorders or autoimmune disease can control, and iodine supplement you do, the thyroid shrinks. So non-surgical way, yes, it's possible. If everybody takes iodine correctly, that person will not develop much thyroid issues. So coming to iodine, we think iodine works only on thyroid. No. It works in the brain, it works in the breast, it works in the pituitary, it works in the ovary. Even ovarian mass is due to that. Even endometriosis is due to iodine deficiency. When you keep a body sufficient, your metabolic health, iodine supplemented, not much problem will come. Do I criticize other doctors? No. It is only informative video. My doctors are my friends, my juniors, my senior. We're all educated, try to help you for better health. That is why this video has been informed. I have no bias with money. This needs to be supplemented. I'm sure soon it will be available in our place. It is available, but I buy from them. This compound creation and all that, one company is willing to help us to do that economically. Okay.